Hello and welcome to Mini Medicos. Today we are going to discuss about peptic ulcer disease, its pathogenesis, symptoms and treatment. H. pylori is a gram-negative bacteria with multiple flagella at one end of bacteria. It is the most common cause of chronic gastritis. It spread through fecal-oral route and humans are the only host of H. pylori. Pathogenesis. H. pylori causes type B gastritis that mainly affects the gastric antral mucosa. It increases gastric acid production and disrupts the normal mucosal protection mechanism. H. pylori contains urea enzyme which convert urea to ammonia. This ammonia convert acidic medium of stomach to alkaline and help the bacteria to survive. It then irritates G cell and parietal cell of stomach and increase gastric acid production which then cause gastric ulcer. Virulence factor in H. pylori are motility by flagella, urease production that help it to survive in the acidic environment of stomach, adhesions that help bacteria to attach to the foveolar cell surface. Toxins like Kage and Vacay are other virulence factors. Symptoms: patient present with burning pain in the epigastric region. Pain is worst when stomach is empty in case of gastric ulcer, while pain is worst after eating in case of duodenal ulcer. Other symptoms are nausea and loss of appetite, frequent burping and bloating, unintentional weight loss, and melena, that is dark color stools due to presence of blood in stool or other symptoms. Diagnosis: investigation of choice is upper GI endoscopy and biopsy. Screening test is urea breath test. Histopathological examination of biopsy sample is done with Warthin steri stain. It shows small curvilinear organisms at foveolar cell surface. Treatment options are triplet therapy. It includes drugs like pantoprazole, clarithromycin, and amoxicillin and clavulanic acid. These drugs are given for a period of 2 weeks. Quadruple therapy includes bismuth, tetracyclines, metronidazole, and pantoprazole. These drugs are also given for 2 weeks. Complications of gastric ulcers are bleeding. In case of gastric ulcer, source of bleeding is left gastric artery. In case of duodenal ulcer, bleeding is more common in posterior duodenal ulcer as compared to anterior duodenal ulcer, and source is gastroduodenal artery. Other complications are perforation. Perforation is more common in anterior duodenal ulcer as compared to posterior duodenal ulcer. Malignancy and hourglass stomach are other complications. Thanks for watching this video. Please like and subscribe Mini Medicos.